the treatment of breast cancer in Turkey. One of the primary reasons why people seek medical help abroad is because they can experience better quality of treatment and conditions, especially when it comes to oncological issues. In this video, we will talk about how women's breast cancer is treated in Turkey, and we will meet with an oncologist who treats foreign patients in a specialized oncology hospital in Antalya, Turkey. Subscribe to our channel and ask questions in the comments. It is all about medicine in Turkey. Breast cancer is the most prevalent form of cancer that affects women. In developed nations, the incidence rate of this disease is approximately 60 in every 100,000 individuals. Breast cancer shows a mortality rate of about 7% if counted among cancer patients of both sexes. But if considering only women, then their mortality from breast cancer is more than 15% among all cancer cases. At the same time, as frightening as these numbers may seem, doctors assure that breast cancer is not a death sentence. It is quite successfully treated if treatment is not delayed and the right approach is chosen. Thanks to significant achievements in both general oncology and the pharmaceutical field, breast cancer is now a completely curable type of cancer. Dr. Barış Özcan, a highly skilled surgeon who has expertise in treating various diseases, including breast cancer. He was born in Samsun and completed his education at 2 universities. His training and specialization took a total of 12 years, and for over 12 years more, he has been working in one of the best oncology hospitals in Antalya, Turkey. At what age is breast cancer most frequently diagnosed in women? Breast cancer is not restricted by age, so young women as well as older women can be diagnosed with it. Detection can occur as early as at the age of 18 and even at the end of life. However, we primarily diagnose breast cancer in patients aged 35 to 55 years. Yet, I must emphasize again that there are cases of the disease in young women aged 18 to 20 and in elderly women as old as 90. Many women are especially afraid of the breast cancer diagnosis for understandable reasons. Doctor, can you tell us how you reassure them? Considering the new and existing treatment methods, can we now say that breast cancer is not as terrifying as it once was? Breast cancer is undoubtedly one of those types of cancer that can now be treated successfully. All types of cancer cause anxiety and concern in people. However, now, due to significant advancements in both general oncology and the pharmaceutical sector, breast cancer is considered a completely curable type of cancer. The advancements I am referring to include the development of surgical techniques, medicinal methods, and immunotherapy in oncology, and the approach to treatment itself is crucial. Therefore, we provide additional psychological support to our patients. We employ a multidisciplinary approach. We comprehensively use methods from oncology and general surgery, and plastic surgery, and radiation therapy. Our hospital has all these departments, so we can confidently say that patients can be completely cured here. What types of treatment do you use most often? Breast cancer requires a multidisciplinary approach to treatment. That is, the joint sequential work of oncologists and general surgeons and plastic surgeons, as well as radiation therapy specialists. Breast cancer is a disease that is treated and controlled by 4 hospital departments together. Here, we can prescribe chemotherapy, immunotherapy, medicinal, and other treatment methods. If a patient has an advanced stage of the disease, we initially aim to reduce the tumor and its affected area before proceeding with surgery. And if the surgery yields a positive outcome, we complete the surgical treatment of the patient with a stage, which we refer to as multiple breast conservation, meaning the protection of the patient's breast tissues. Our task here is not only to save the patient from cancer, but also to preserve the breast tissue cosmetically as much as possible. These are operations that we, general surgeons, perform together with plastic surgeons. What are the important factors for achieving successful treatment of breast cancer? I have been involved in cancer treatment for about 15 years, and I am convinced that one of the most crucial elements is emotional support. The point is to be present with the patient, offering emotional support, and not leaving them alone with the illness at any stage. because chemotherapy can be administered anywhere. Surgery can be performed in various places. Radiation therapy is available in many locations. However, the most critical aspect of combating cancer is maintaining a positive mental attitude, fighting spirit, and motivation to continue the battle. I am sure that the mindset and inner motivation are very important in cancer. I approach my patients not only as a general surgeon. I always engage with them as a psychiatrist, psychotherapist, and friend to ensure they have a strong, confident mindset. When we support patients, they already start to feel better. As with any oncological disease, the prognosis for the patient depends on the stage at which treatment is started and the effectiveness of the chosen therapy methods. Turkey offers patients one of the best price-quality ratios in the world. There are excellent hospitals, competent doctors, and the latest cancer treatment technologies at affordable prices. But to avoid making a mistake in choosing a clinic and doctor, it is advisable to consult with independent doctors who know the specifics of particular hospitals and doctors. In Turkey, this can be done for free in a special service company. Its staff are real practicing doctors with diplomas and work experience in Turkish clinics.
After a person submits a request for treatment in Turkey, we, the coordinating doctors of Healthy Turkey, select the best clinic and doctor for them based on their diagnosis, wishes, and needs. As practicing Turkish doctors, we know exactly how to do this as correctly, quickly, and effectively as possible. We constantly accompany the patient throughout the whole trip, and we always stay in touch for any questions that may arise even after the patient returns home. We also talk a lot about our work on our Instagram account. You can subscribe to our Instagram via the link or QR code to get to know us better and, of course, to understand how our company works in general.
How significant are the chances, do they even exist, that the breast can be preserved in these cancer types? And in which situations is breast removal unavoidable? To prevent severe consequences of breast cancer, it is essential to undergo regular checkups. That is, the more often women undergo regular checkups, especially starting from the age of 20, the sooner we can detect these diseases at very early stages. Believe me, early diagnosis saves lives. If breast cancer is detected in a later stage, the patient will need to undergo chemotherapy first. Then the patient should go to radiation therapy and other necessary treatments. Breast cancer often appears not only within the breast, but also on the skin tissues. Treatment often concludes with the complete removal of the breast, known as a mastectomy. These are the outcomes of late-stage treatment. How long is the rehabilitation period on average? The recovery time after breast cancer surgery typically ranges from 6 months to a year. Surgical intervention is necessary for breast cancer treatment. After the surgical stage, there is a stage of chemotherapy and radiation therapy. On average, these treatments continue for about 6 months, and rehabilitation takes around a year, so that the patient can fully recover and return to a normal state of health. Is it possible for all individuals who have undergone breast cancer treatment to receive reconstructive surgery for lost breasts? Yes, and the surgeries we perform with plastic surgeons are known as oncoplastic surgeries. It has become very popular in recent years. When women are diagnosed with breast cancer, when they hear these words, they want to have the internal breast tissues to be removed and replaced or supplemented with a prosthesis so that the breast's appearance is fully reconstructed. Such oncoplastic surgeries can be performed for all types of breast cancer. After understanding the topic and getting a hopeful prognosis, the patient just needs to decide on the treatment setting. It's a matter of comfort. Even in an oncology hospital, it is possible to stay with all the necessary comforts and amenities. Comfortable rooms in Turkish hospitals are not an exception, and they do not require significant additional expenses. Treatments are conducted not just within the confines of medical offices, but are also offered in sophisticated halls with a serene and welcoming ambience. While maintaining regular medical oversight, we showcase the interiors of Turkish oncology hospitals, their equipment and patient experiences in a big special video. You can watch it by this link on the screen. We also have a whole series of interviews with oncologists of various specializations, and a separate playlist on the Health in Turkey channel is dedicated to cancer treatment in Turkey. Watch it via the link in the description below and share it with friends. Feeling comfortable, confident, and calm, being surrounded by care is an important factor in the success of treatment. All oncologists say this. Turkey stands out favorably from other countries with its comprehensive approach to patient care. In other countries, you often have to pay separately for each procedure. The organization of medical tourists' visits to Turkey on an all-inclusive basis is handled by the Healthy Turkey Company, which works only with verified specialists in both medicine and the hospitality industry, coordinating all their efforts for each individual patient. Healthy Turkey takes care of everything, from consultations and arrangements with the clinic and doctor to transfers, accommodation, migration formalities, and translation of medical documents. For consultation, you can contact this phone number or through the chat on the company's website. The address is on your screen. There is also a lot of information on other areas of health tourism on this website. Don't forget to subscribe to our channel and don't miss new videos about medical tourism and assistance to foreign patients in Turkey.